I'm Tom Van Winkle from the School of Veterinary Medicine of the University of Pennsylvania. I'm going to be discussing diseases of the dog and cat. These slides are arranged by system, beginning with the nervous system and extending through genital, fetal muscle, and skin. Most of the carousels are arranged according to types of disease, beginning with congenital or inherited disease, extending through inflammatory diseases, and ending up with neoplastic diseases. I would like to thank the many people who have contributed these slides, taken these slides over the years, both at the University of Pennsylvania and at Cornell, particularly all the residents and other faculty members who have contributed these slides. Okay, we're going to begin with the brain and spinal cord. This is tissue from a dog. And this is a case of hydrocephalus in the dog. This is a cross-section of that brain of the dog, and you can see the ventricles are widely dilated with a very thin cortical mantle remaining. Most of these cases have an open third ventricle and open aqueduct, so the cause is often undetermined. This is another section from a dog. This is a case of poor encephaly. Also, in some people's minds, this is called hydranencephaly. Usually these are continuous with the ventricles. This is another dog. This is a little hard to see, but what you want to notice here is the lack or the atrophy of the optic nerves. This could either be optic nerve hypoplasia or optic nerve atrophy. This is a section from a cat's brain, normal on the left, abnormal on the right. This is a case of agenesis of the corpus callosum. This is often seen in association with other defects in the brain as well. This is from a dog. The head has been removed, and we're looking at the foramen magnum. And the abnormality is a defect in the foramen magnum called a keyhole foramen magnum. This is of no clinical significance, but is a common finding in small breeds of dogs. This is from a dog. This is a standard poodle. We've also seen this in the golden retriever. This is an inherited condition. It's autosomal recessive. There are multiple small gyri, and this is called polymicrogyria. These dogs, when it involves the occipital cortex, are often blind. When it involves the more rostral cortex, as in this case, the dog also had seizures. This is from a Lhasa apso. And this is sort of the opposite of polymicrogyria. This is lissencephaly, no cortical gyri or sulci, and this is thought to be inherited in this breed. This is from a young beagle. We don't know the cause of this leukodystrophy. We see these occasionally in the dog that have gross manifestations, usually animals with amyelinogenesis or hypomyelinogenesis have very minimal lesions grossly, but sometimes they do have rather dramatic cavitation like this young dog. We were unable to determine the cause in this case. This is an older dog. This is a common postmortem finding, fibrosis of the leptomeninges, and it's of no clinical significance. You need to differentiate it from meningitis. This is from a cat. And this is cerebellar hypoplasia. Often these cats will live to old age. I think this animal was an adult, and they do quite well. And this is due to either in utero or neonatal infection with panleukopenia virus, destroying the external granular layer. This is from a dog. And these are infarcts in the brain. We're finding these to be much more common than we at first thought. This is another dog where we involve the distribution of the anterior cerebral artery with areas of necrosis and hemorrhage. We recently did a retrospective of brain infarcts in the dog. This was done by Byron Ruiz in our laboratory, and we found that 44 dogs, about 0.7% of the canine necropsies, had brain infarcts. This is about the same incidence as we see for meningiomas. As in humans, the majority of cases involve the cerebrum and involve the involvement of the middle cerebral artery. The clinical signs reflected the site of infarction. We often find animals with cardiac and vascular disease that had these infarcts, and usually the duration of clinical signs in these dogs was very short. Recently, we have followed some cases through a referral neurologist where the animals, just as the humans do, recover from these infarcts, depending on the cause. Of these 44 dogs, we found that they fit into one of three categories. Either they had thrombi or primary vascular disease of the brain, embolic disease, from disease of the heart, or we could not find any predisposing cause for their infarcts. This is from a cat. Changes here are rather subtle, but on this side of the brain, the left side in this photo, the brain is swollen, and the gray-white distinction is not as clear as it should be. And this is an acute cerebral infarct in the cat involving the distribution of the middle cerebral artery. It's another cat. And this is what infarcts of the middle cerebral artery look like in more chronic cases, where there's been collapse of the tissue, astrogliosis, and in some cases some mild fibrosis. This is a cross-section of a similar case showing again the distribution of the middle cerebral artery. Recent work at Cornell indicates that these are probably a reaction to Cuterebra larvae migrating usually in the nasal cavity or sinuses, somehow causes a change in the vessels. Many of these cats also have a very mild eosinophilic meningoencephalitis as well, which is consistent with the Cuterebra hypothesis. This is from a dog. We have multiple discolored areas that are areas of malacia involving the caudate nucleus, the lentiform nuclei, and the hippocampus. And this is a case of intoxication with moldy yogurt. And the actual intoxicant component is not known, but we've seen a couple of these cases in the dog. We don't have as many well-known toxins causing brain disease in the dog as is known in larger animals. This is also from a dog. Multifocal hemorrhages involving the brainstem. This is a classic presentation for infectious canine hepatitis or canine adenovirus encephalitis. These animals have vasculitis with intranuclear inclusion bodies in their endothelial cells. Luckily, this is a relatively rare disease these days. due to vaccination. This is also from a dog. You can probably get the diagnosis if I tell you it's from my pug dog. This is a very typical presentation for pug encephalitis, or encephalitis of pug dogs, where one side of the cerebrum is more affected than others. The brain stem, or at least in this case, the caudate nuclear area is not as severely affected. There is necrosis and inflammation here with often cavitation. The involvement is usually bilateral, but usually more severe on one side than the other. This is thought to have an inherited basis in the pug, but the actual cause is unknown. If this was a pug dog, you could say this was a case of chronic pug dog encephalitis, but this is a Maltese dog. And in this case, it has severe chronic inflammatory disease, again involving the cerebrum. Occasionally there is thalamic involvement, but usually there is no brain stem or cerebellar or spinal cord involvement. This makes it somewhat different from the encephalitis seen in Yorkshire Terriers reported from Europe, where there is involvement of the more caudal aspects of the brain as well. We like to consider all of these, including the ones we see in Chihuahuas and other dogs, as an idiopathic necrotizing encephalitis of young, small breed dogs, because that's what we see it in. We do not know the cause. People have speculated on a viral or immune-mediated cause, but we do not know the cause at this point. We're very interested in these cases. If you have any, we'd like to see them. This is from a dog also, German Shepherd, old middle-aged dog. We see a mass lesion here. There is destruction of the normal hippocampus, parahippocampal gyrus in the piriform lobe here. You could think of this as an old infarct, an old area of inflammation, or a neoplasm. In this case, this is rather focal granulomatous meningoencephalitis, or GME, in the dog. This is another dog. This is a Jack Russell Terrier. We have these focal areas of yellow-tan discoloration that are also softer than normal. And this is another manifestation of granulomatous meningoencephalitis in the dog. Again, a disease of unknown cause. What is its relationship to encephalitis of young small breed dogs? We don't know. They don't look the same histologically. And in this disease, we again see mostly in sort of young to middle-aged dogs, and often they are small breeds, but sometimes they're larger. Another common gross manifestation of this disease is no obvious change whatsoever. This is another dog. This is a little more subtle change, again, the optic nerve. We have one swollen gray optic nerve. This could be a glioma involving the optic nerve or some sort of inflammation. In this case, this is optic neuritis. And in this case, this animal had GME, granulomatous meningoencephalitis, involving the optic nerve. Remember, the optic nerve is not a peripheral nerve, it's part of the brain. Okay, this is from a cat. These are usually young cats. They may or may not have eye involvement or kidney involvement. They often have this plaque-like lesion on the surface of the leptomeninges. You could consider lymphosarcoma, but this is a case of feline infectious peritonitis involving the meninges. This is another cat. This is a little more typical, with this sort of granular appearance to the choroid plexus and the lining of the ependymma. Cats with feline infectious peritonitis, such as this, often have ependymitis as well. These cases, about 50% of the time, will have a negative titer for FIP. That's important to keep that in mind. This is another cat, swollen brain, looks sort of similar to the infarct that we saw previously. This is a case of acute toxoplasmosis. We would also see a similar picture with Neospora. An acute inflammation, we also see this as a more chronic inflammation. But usually there is some degree of swelling when it's of clinical significance. This is from a cat also. Multifocal, sort of granular, soft areas, a little bit on the meninges. These are sort of soapy when you touch them. And this is a case of cryptococcosis in the cat. Many of the cases we see do not have nasal involvement. I don't know why. That's what they're supposed to have. This is from a dog. This yellowish area of discoloration here, there's also some meningeal involvement and some involvement of the vermis. And this is cryptococcal infection in the dog's brain. I hesitate to call these meningoencephalitis because, as you know, there's very little inflammatory response to these large masses of fungal spores. If there is a response, it's usually macrophages. This is by far the most common systemic and fungal infection we see in the Northeast involving the brain or spinal cord. This is from a dog. This is an older dog, although this disease had been recently described in younger dogs. And these dogs have seizures. They have dramatic thickening of their meninges with involvement of their superficial cortex. And this is referred to as meningoangiomatosis because there's also a proliferation of small blood vessels in here. There's evidence of prior bleeding with hemosiderin as well. Okay, shifting gears a little bit. This is an animal, a dog with hydrocephalus, a mass-like lesion occluding the aqueduct that caused the hydrocephalus. And when we think of mass-like lesions in the dog brains, we could think of inflammatory disease. In this case, this is a neoplastic disease. This is an astrocytoma. Many of these neoplastic diseases, it's very difficult to tell by looking at the photo what disease it is. You should just have a series of differentials in a case like this of inflammatory or neoplastic usually. This is from a dog also, 7-year-old. The critical thing is noticing this little pink to red mass bulging from the lateral aperture of the fourth ventricle. And this is a very common presentation for a choroid plexus tumor. This is also a dog. This is another common presentation for the choroid plexus tumors with third ventricular involvement. There is some controversy about how we name these tumors. My point of view is if they invade and metastasize through the cerebrospinal fluid, then I refer to them as carcinomas. The others I refer to as papillomas, although there is some simplicity to the idea of calling them all just choroid plexus tumors. This is the spinal cord from a dog. Here's the cord here, and here's this tumor. This could be a variety of different things, lymphosarcoma, meningioma, malignant peripheral nerve sheath tumor. But this is also a typical presentation for choroid plexus tumors. This is a dog. And this is supposed to be the most common presentation for this tumor in dogs with flat faces. This is a plaque-like meningioma involving the caudal fossa. This is another dog, and this is what these meningiomas look like after the brain has been removed. They're often tightly adhered to the dura, which stays attached to the bone, and these can be very difficult to remove surgically, if not impossible. This is a cat. And this is the manifestation we see of the cat with third ventricular meningiomas. We don't see third ventricular meningiomas in the dog, only in the cat. It's probably because the tela choroidea extends into the third ventricle in the cat. This is from a dog. You should have a number of differentials here. This does happen to be a meningioma impacting on the optic chiasm here. This could be a germ cell tumor or a pituitary tumor as well. These usually lead to blindness. This is from a cat. This is a much more typical tumor in the cat, and I'll just show you the next slide as well. This is what the brain looked like when this was removed. And this is a typical meningioma. They're often adhered to the dura, but not to the brain. These are easily shelled out. We've followed 20 or 30 of these cats so far. They do quite well after having them removed surgically. So we don't see this manifestation much anymore, the meningioma at necropsy in the cat, at least from this location, because they're easily removed. This cat, things got out of hand. This space-occupying mass led to movement of the brain and herniation of the vermis. Okay, this is from a dog. This is a very common manifestation of this brain tumor in the dog, where we have a normal piriform lobe on this side and a swollen piriform lobe on the other. When you see this, you should be thinking of glioma, and this is a common site for astrocytomas, and that's what this one is. In cross-section, you can see sort of a liquefied center to this mass. They're often quite soft, and I could not grossly tell this astrocytoma from an oligodendroglioma, but this was an astrocytoma. These are the most common tumor of the brain itself in the dog, where they're about equal to or slightly less than the incidence of meningiomas in the dog. This is a cat. This is a rare tumor in the cat. There's a lot of hemorrhage here. The borders are there, but they sometimes blend into the adjacent tissue, and this is an astrocytoma in the cat. Certainly all glial tumors, except for ependymomas, are rare in the cat, if you consider the ependymoma part of the glia. Some do, some don't. This is a dog. Another tumor here. Again, this could be an astrocytoma, could be an oligodendroglioma. This is a very invasive tumor with proliferating capillaries, areas of necrosis, lots of anaplasia. Although we don't see giant cells in this tumor in the dog, this is a glioblastoma multiforme, which is also known as a malignant or highly anaplastic astrocytoma. These are GFAP positive, so in a sense they are astrocytomas. Okay, this is from a dog also. And well-circumscribed, gray, soft tumors like this usually end up being oligodendrogliomas histologically, and that's what this one is. This is probably the second most common glial tumor of the dog. They're very rare in the cat. Interesting section of the brain. This is a very typical site for these oligodendrogliomas, and there's often some secondary hemorrhage when they break into either the ventricle or out into the subarachnoid space, and that's probably what leads to the death of these dogs. Tumors of oligodendrocytes. This is a dog. This is a tumor we've seen occasionally in the dog, and depending on what part of this tumor you look at, you can make one of two different diagnoses. There's parts of this tumor that look like an astrocytoma. Other parts look like a cystic ependymoma. So these are sort of astrocytoma ependymomas. The few that we've seen have been very slow growing. This one clearly was not removed surgically, but I think this one had 2 previous surgical attempts. This dog lived for 2 or 3 years after the first surgery and did reasonably well between surgeries. They're very slow growing. we attempted to characterize these immunohistochemically, and they do seem to be both astrocytomas and ependymomas. This is a cat. This is the most common glial tumor, or tumor of neural glial origin, at least in the cat. This is the ependymoma. They actually look like ependymomas in humans, as opposed to the few ependymomas I've seen in the dog, which are very anaplastic, poorly differentiated. I think this one, there was an attempt at surgical removal, and then there was some herniation afterwards. Okay, this is a Great Dane, 3.5-year-old. This tumor extended into the cerebellum here. This is not just on the surface. If it was just on the surface, you'd want to consider that this was lymphosarcoma. But this is a primitive neuroectodermal tumor, which are also called medulloblastomas, very primitive tumors. We're attempting to characterize these in our laboratory, and what we've found so far is they will stain with vimentin. They will be positive in some cases for gliofibrillary acid protein, but they rarely are positive for neurofilament or synaptophysin. So they appear to be, as a group, somewhat less differentiated than what is seen in humans. This is another interesting tumor in the dog. We've seen a number of these. The tumor is not in the tissue. These are all infarcts. The tumor is actually inside the vessel, and this is intravascular lymphoma in the dog. These are tumors that actually live in the vessels, but they do not circulate. They can be present in the brain, the skin, the lung, as well as a number of other organs. But the tumor cells seem to be somehow held in the vessel lumen. They're very anaplastic tumor cells, and this is a first few of these we saw was rather challenging diagnosis. This has been published as, I believe, angioendotheliomatosis or something like that by Brian Summers at Cornell. He and I both agree now this is probably an intravascular lymphoma. And they don't have any mass-like lesions anywhere in the body in these cases. This is a classic tumor and an excellent photo taken by one of our residents, I believe. Brain's only partially fixed, but that adds to the beauty of the photo. These animals usually have large bloody masses in the spleen, liver, right atrium or lung, sometimes kidney, sometimes omentum, and this is the other common manifestation. This is by far the most common metastatic tumor we see in the dog. This is a hemangiosarcoma. They can be a few of these, but they're usually miliary like this. This is the second most common metastatic tumor that we see in the dog, and this is a carcinoma, in this case a mammary carcinoma. They usually tend to be in the cortex. They tend to be sort of at the gray-white junction when they begin. They're usually multiple, but they're not miliary, and they're rarely in the brainstem, because if they grew this big in the brainstem, the dog would have been dead long before this. We don't see as many of these as we used to. I think it's because we're spaying dogs earlier in our profession and also removing a lot more mammary tumors earlier. But we do still see them occasionally. We also see other carcinomas metastasize to the brain, not just mammary carcinomas. This is one that we've seen occasionally. It's been reported. This is a metastatic malignant histiocytosis. We're also seeing manifestations of malignant fibrous histiocytoma in the brain, and often there'll be mass-like lesions. Other times, particularly with malignant fibrous histiocytoma, they will wrap around the cord or spread along the meninges of the brain. And we also find cases where immunohistochemically, in some areas it looks like MFH, in other areas it looks like MH, or malignant histiocytosis. There's a lot of confusion about these tumors. Clearly, in most cases, they're distinctly separate, but Roy Curlin and Matty Hendrick from our laboratory have recently submitted a paper on the problem of distinguishing these two tumors. You're much better off if you only look at a very small biopsy and don't do any immunohistochemistry. Then you won't be confused. Of course, I don't mean that. Okay, this is a cat. It's a common manifestation of this tumor in the cat. usually when there have been other sites in the body involved, and that is meningeal involvement of lymphosarcoma. Now, we also have tumors of the nervous system that aren't primarily of the nervous system and don't metastasize to the nervous system, but impinge upon it. And we have seen cases of lymphosarcoma in the cat that appeared to start in the pharynx, grew right through the floor of the skull and into the brain. Sort of similar to what we see with the sinuses and nasal cavity as well. This is a very common tumor of the cat and a little less so of the dog. This is a pituitary tumor, either adenoma or carcinoma, depending on whether it's invaded or spread. These invariably extend quite far up through the hypothalamus and thalamus in these animals. I'm always surprised at how often their clinical signs are sudden when they have such large masses. This is from a dog. This is a tumor that Brian Summers and others from Cornell has published about. This is a supracellular germ cell tumor. It looks very similar to the meningioma we showed before. When we go back through our slides, we really can't find anything that looked like craniopharyngiomas. I think all the ones that, or at least some of the ones that have been reported from Penn in the long past, were probably supracellular germ cell tumors. Okay, this is from a dog. This is a peripheral nerve sheath tumor that's come up through probably the 7th or 8th nerve. Again, this animal presents with unilateral vestibular and cerebellar signs. And although other peripheral nerve sheath tumors often look like the malignant peripheral nerve sheath tumors, the ones we have seen from the cranial area tend to look more like the schwannomas seen in humans, and maybe they could be surgically removed if diagnosed early. Okay, this is from a dog, and these are not multiple tumors. This is what happens when we've had multiple cervical root avulsions with subsequent neuromas formed. This was in the area of the forelimb, so probably this animal was hit and dragged by a car. Usually these are unilateral, but these are not neoplastic manifestations. We often see these in the subcutis and the skin, tail docking sites, injury sites, and it's very helpful if you do an axon stain like a Holmes stain to see the small axons among the proliferation of neurofibroblasts and Schwann cells. Okay, this is from a dog. The next group are rather classics. This is a cervical disc protrusion. We've had taken the spinal cord out here, the dorsal up here, ventral down here. This is a protrusion of the disc. These are extremely common, particularly in chondrodystrophic breeds. Sometimes things are very severe. In this case, that there was a piece of the cervical, but intervertebral disc material that entered the cord and caused extensive destruction. This destruction usually extends both rostrally and caudally. And occasionally in large breed dogs, we see the entire center of the disc protrude rapidly up into the cord. These will happen in the cervical area. And you see sudden death in these dogs. It's one of the reasons why we now look at the cervical spinal cord routinely in case of sudden unexpected death. We've seen a couple of cases like this. We've also seen some fractures, some penetrating wounds, and things like that. So it's important to look at the cervical cord in cases where you can't explain their death otherwise. But this appears to be an acute disc herniation. Very little hemorrhage or anything else involved. These animals die very suddenly because if this happens at C4 or 5, we get the phrenic nerve coming out there, and they die in a matter of seconds probably. Okay, this is trauma to the cord. This is also extremely common. We see it a lot in dogs and cats, and usually there is an area of trauma, and then there's ascending and descending necrosis, usually of the dorsal part of the cord for some reason. I'm sure there's both chemical mediators and vascular events involved in this process. This is Weimaraner. This low power view of a histologic section, and what you see is incomplete separation of the ventral horns and an incomplete ventral fissure here, and this is what we see with spinal dysraphism in the Weimaraner. These dogs eventually go on, in many cases, develop syringomyelia or hydromyelia and then syringomyelia as well, but the actual defect that leads to their clinical signs is probably the change in distribution of the neurons there. Okay, this is the end of the spinal cord in the area of the cauda equina. In a cat, could be a dog, doesn't matter. When you see this material surrounding the cord here, you got a number of options. One, it could be fat. If you put it in water and if it floats, that's probably what it is. Two, if it's really soapy feeling, it could be what this is, and that is cryptococcal involvement of the meninges. And the other is that if this is firm, and when you do an impression smears, you see a lot of round cells, this is lymphosarcoma. We're in the process right now of doing an examination of a series of spinal cords in cats, trying to figure out what's going on, and this is a condition we see sporadically. This is Lugol's iodine put on these sections of cord, and this is relatively normal cord except for this area down here. And this is a ventral spinal arteritis with infarction of the cord. We've seen this in a number of animals. There do not seem to be any fibrocartilaginous emboli involved. Some of these cases clearly have feline infectious peritonitis, but others do not, at least as far as we can tell from looking at the other tissues. So this is a little bit of a mystery to me. Perhaps it's analogous to the spinal arteritis we see in dogs, the old beagle pain syndrome. Okay, this is another section of a similar spinal cord in the dog, except this is an area of infarction of the cervical spinal cord. And again, in most of these cases, we do find fibrocartilaginous emboli from wherever they come from. When we see this in the cervical area, it tends to be more unilateral, although there's a little involvement on this side, where when we see it in the lumbar area, it tends to be bilaterally symmetrical. Okay, this is a cat. We have these irregular areas in the cord that are where we don't see the gray-white distinction. And this could be a lot of different things. It could be an infarct, could be a tumor, but most commonly, and that's what this is feline infectious peritonitis. We see a lot of involvement with FIP with the cord. In all the cases we've looked at so far, there is brain involvement as well. There's frequently eye involvement, and the other organ that's most involved is the kidney. These animals usually do not have the effusive or wet form. Okay, this is a young, large breed dog. I'll show you the next slide too, but we can see there is this purple mass here, and this is always at the TL junction in the spinal cord. And this is what it looks like on sort of subgross. You can see this proliferation of cells that's pushed the spinal cord aside. These do not extend outside the dura, so they have not come in from the outside. They're not peripheral nerve sheath tumor, and this is the spinal cord tumor of young large breed dogs. That's what we're electing to call it now. Many people have thought that this is a ectopic nephroblastoma, and I happen to concur with that group. I think that's what this probably represents, is an embryonal kidney tumor that's been misplaced. Okay, this is something we don't see much anymore because almost all of these animals have surgery rather than necropsies. And these are firm proliferations involving multiple nerve roots, usually in the cervical area. They may be in the lumbar area. Dan Brem and Charles Viet and a student and I recently published a paper on this in AHA, and these are malignant peripheral nerve sheath tumors. Excuse me. They all invade. Prognosis is very poor. This is a close-up of a similar tumor. Again, they usually involve multiple roots, and they invade into the spinal cord itself. These are very common. They're usually unilateral, and we do not know the cell of origin. In the past, these have been called schwannomas, malignant schwannomas, neurofibrosarcomas, neurolemomas, and I think they're best referred to as malignant peripheral nerve sheath tumors. This is a little bit of a fooler. This is a dog that has a similar looking lesion, and we can see these anywhere along the cord, either epidural or intradural, and we see these also commonly in cats. And this is lymphosarcoma involving the peripheral nerves. A relatively rare tumor of the dog, and I'll show you the next slide. There's the mass here. Now we're getting more of these on our surgical biopsy service because they pop right out, and depending on where it is in the cord and how big it is, the dog may recover quite a bit. And these, just like they are anywhere else in the body, are meningiomas. This is a cat. Spinal cord, we've removed the dorsal facets. This is an extremely common problem in the cat. We see a lot of tumor, and in the dog, tumors that impinge upon the cord. This is the most common one, osteosarcoma. We also see lymphosarcoma act like this. Also bone tumors of other sort, chondrosarcomas. We've seen myelomas do this. Lots of different tumors that can impinge upon the cord. These are extradural, though. These are outside the dura and are not involved in peripheral roots. Okay, and the last slide in this carousel and in this spinal cord presentation is a lesion probably you've not seen if you're relatively young. This is an Afghan hound, and this is the necrotizing myelopathy of Afghan hounds, where the purple stain is for myelin, and there's complete loss of the myelin throughout the spinal cord, usually in the thoracic area. Okay, next carousel. Okay, next is the cardiovascular system. One group of diseases we've been very interested in lately is thromboembolic disease. They used to be thought that these were very uncommon in the dog. Now we know they're quite common. And we've published some papers on both aortic and portal vein thrombosis, and a number of people have published on pulmonary artery thrombosis. And we're working on a paper in brain infarcts, as we mentioned previously. This is a dog that had been on corticosteroids for immune-mediated disease. It has a large aortic thrombus. This is not an embolus in this case, although we do see emboli here about 50% of the time that there are masses of like this in the aorta. They are emboli, and the other half are thrombi. And we can also see there are multiple infarcts in the kidneys here because it's involved the renal arteries as well. We see this with glomerulonephritis as well as with corticosteroids. This is a cat. There's a very different condition in the cat where these are easily plucked from this site in the caudal aorta. These are emboli, and these are associated with cardiomyopathy. All the different forms of cardiomyopathy can be associated with thromboembolic disease in the cat, and this is the most typical site of the emboli, although they can lodge elsewhere as well. In the dog, we commonly see this condition also, with or without primary splenic disease. There are often splenic vein thrombi, which extend back into the spleen and lead to venous infarcts of the spleen. These are associated with the same conditions that we've seen with portal vein thrombi. This is also a dog, liver, duodenum, pancreas, and there is the portal vein. We've collected maybe 20-some cases of this so far in the dog. They're again usually associated with corticosteroids administration, usually in high doses. They're often associated with pancreatic necrosis. We've got a little bit of it in this case. We've seen them associated with any inflammatory disease in the anterior abdomen. If these grow very suddenly and very quickly, this is the liver up here, here's the portal vein here, they can lead to venous infarction of usually the mid-jejunum through the mesenteric vein. And this has been seen in about 3 or 4 of the cases we've seen with portal vein thrombosis. These animals present with very acute abdomens. The other animals present usually with chronic conditions and ascites. And they may develop secondary shunts. These are not usually acute thrombi, though. When you look at the attachment sites of these thrombi, these are not emboli. There are vessels growing into here. There are fibroblasts growing in here. So these things are usually subacute to chronic. They slowly build up enough material on them to lead to the clinical signs. But these usually are weeks old, and they usually are consistent with whatever other disease is going on that led to them. Same with the pulmonary artery thrombi. These can be emboli if you have jugular vein or other veins in the body that have thrombi. They can embolize quickly to the pulmonary arteries. But even if they do, they tend to grow here under certain conditions. Also, many times we're convinced these are primary thrombi in the pulmonary arteries. They also tend to be very chronic. Lots of endothelialization. Sometimes they're of 2 different ages. Here's an extremely chronic one. There's a more subacute to chronic one. And then as you follow these back towards the hilus of the lung, they get younger and younger, because these probably start in the periphery of the lung and grow back towards the hilus. We're currently working on a project with one of our residents, and we're going to hopefully publish that stuff within the next year or so. We again see these associated with a variety of different conditions in the dog. We've excluded heartworms from this condition. This is not the villus arteropathy that you see with heartworms. These are the conditions we see this with in the dog. Steroid therapy is by far the most common. It's been published as being associated with autoimmune hemolytic anemia, but we haven't seen a case with autoimmune hemolytic anemia that hasn't been given some steroids. So we're still concerned about it. And we think this may have something to do with steroids inhibiting the production of tissue plasminogen activator. Again, we see it with Cushing's syndrome, which goes along with this. We see it with a variety of renal diseases, not all glomerulonephritis, not all animals that have loss of antithrombin 3. I think there's some interesting studies in mice that indicate perhaps this has to do with levels of plasminogen activator inhibitors. We also have seen it with protein-losing enteropathies, with pancreatic necrosis, which has manifestation throughout the body. And I should mention that recent literature in the humans has linked chronic renal disease and pancreatic disease to multiple organ thrombosis, not just ones occurring at that site. As you know, thromboembolic disease is extremely common in humans, less so in the dog, but much more common than we used to think. We've also seen it associated with these other conditions as well. Okay. Heart, coronary artery thrombosis. We've also seen a number of these cases, and we are currently looking at the association of coronary artery thrombosis to other disease in the body and myocardial infarcts. This is an example of myocardial infarct in the dog. So thrombus in one of the coronary arteries and multiple areas of necrosis. These can be very subtle when they're early. We just see areas of necrosis, areas of discoloration, but if you look at these areas, they usually, outside of this field, are pretty well defined. And Sunita Driehaus from our school is currently working on a paper on this for the veterinary literature, describing, I think, 30 or 40 cases of myocardial infarcts. Something you have to differentiate it from is the neurogenic cardiomyopathy, or brain-heart syndrome, where we see areas of necrosis associated with brain or spinal cord injury, whether it's trauma or infectious or tumor. This is also a relatively rare cause of myocardial infarcts in the dog when we see hypothyroid dogs with atherosclerosis. They also have it in other sites. Another manifestation of thromboembolic disease that we've been seeing is dogs with extremely swollen heads. This is the right atrium. This is the anterior vena cava, and here's a large thrombus that extends up both jugular veins and has occluded the anterior vena cava. These dogs do not do well for very long. Okay, other vascular disease. This is also a dog, a young dog. We see this in cats as well. This is a dog with multiple peripheral portal or mesenteric to caudal vena caval shunts. These dogs usually have small livers. They're usually inherited. This is another dog, very small liver. This is a large breed dog, though, and large breed dogs tend to have large intrahepatic shunts that extend from the portal vein directly into the caudal vena cava. When the shunts are peripheral out here in dogs, small dogs, and in cats, usually the portal vein gets very small or is hypoplastic before it enters the liver. These are extremely common. There's a variety of different manifestations of these. Some of them perplex the ultrasonographers because here's the small liver, there's the portal vein, but we have a large shunting vessel that goes back through a colonic vein into the very caudal vena cava behind the kidney. No one looked back there. Now they look. Lots of different congenital heart defects in the dog. This is a large breed dog, and this has a very large patent ductus arteriosus, and in fact this one was a right to left shunt instead of the usual left to right, so it has unique manifestations in the lung where we see these glomeruloid-like arteropathies in the lungs. I think of these as sort of pressure reduction valves in these dogs with right to left shunts of any sort. We see these also in some dogs with pulmonary hypertension from other reasons. Other interesting defects in the heart, we can see these primarily in the dog. There's a number of different problems in this slide. We've got rostral esophagus is dilated. We've got a band across it, and that's the persistent right aortic arch. And we've got a hole through the middle of the ventricular septum, so it's got a ventricular septal defect as well. And that's an important thing to remember. When you see one congenital anomaly, make sure you look for the others. We don't see as many of these as we used to because many of them are surgically corrected, although we have seen 2 in the last few months. Common disease in many species, common condition, not necessarily inherited, but certainly congenital, and that's a ventricular septal defect. Some of them are sort of incomplete. This one happened to go all the way through. This is another dog. This is the left ventricle. And this is a case of subaortic stenosis, a band of connective tissue here right below the aortic valve. These often have left ventricular hypertrophy and may die suddenly. This is a dog also. This is the right ventricle. And this is a case of pulmonic and subpulmonic stenosis. Usually these also have ventricular hypertrophy on the right side, but they may be clinically silent. Congenital heart disease in the cat is a little different. We often see very large hearts in these cats, up to 40 or 50 grams sometimes, dilated ventricles, but we don't tend to see the shunting of blood in these cases. What we tend to see is valvular anomalies. And the last couple of congenital disease, this is a young kitten. This has fibroelastosis, relatively uncommon in the cat, and a rather incidental finding we sometimes see in the dog, and that's these valvular hematocysts, usually incidental findings. We're going to continue with cardiovascular disease. First, we're going to talk about a series of conditions in the cat. There's been a bit of confusion about this lately. I hope our recent publication in Vet Path has helped straighten that out, one that Dr. Stalis wrote, concerning cardiomyopathies in the cat. This is tissue from a cat. As you can see, there isn't much left ventricular lumen here, and we have a very thick left ventricle. When we see this, and when histologically we don't see significant changes in the myocardium, there may be some areas of fibrosis, there may be some disorganization, but nothing that we can be sure of, then those are the ones we call hypertrophic cardiomyopathy. As in all cases of cardiomyopathy, you have to exclude all other types of conditions that might have led to hypertrophy, hypertension, inflammatory disease, vascular disease of other sorts. This is another cat, and this gives you some idea of the difference in size between a hypertrophic cardiomyopathy and a normal cat heart. These cat hearts are usually greater than 0.4% of body weight, and usually greater in absolute weight than 16 to 18 grams, being about normal. This is another form of cardiomyopathy in the cat that we don't see much anymore. This is the taurine-dependent dilated cardiomyopathy in the cat. This is the more typical manifestation we have of cardiomyopathy cat. When we open the chest of these cats, they tend to have fluid in their chest. Most of it's been removed here. They tend to have firm lungs, and they do have interstitial lung lesions. They tend to have large hearts and dilated left atrial appendages. Our rule is if the left atrium is bigger than the right, there's probably something wrong with the left side of the heart. This is a case of endomyocarditis. This is what these look like when you open them up. Sometimes the lesions are very subtle, but in the left ventricular outflow tract there is a reddening, and when we look at that histologically, we see either acute inflammation of the endocardium. In this case, we may see subacute changes with granulation tissue and inflammation. There may be inflammation in the myocardium. And we also see more subacute to chronic changes with granulation tissue beginning on the endocardium. There still may be inflammatory lesions here. These we refer to as endomyocarditis. This was first published by Dr. Liu 20 or 30 years ago. We have recently published on it because it seemed like people had been ignoring this lesion in the heart. You need to look at all these hearts histologically to decide which category they fit into. These tend to be young cats. They tend to have recently had a stressful experience. They do not have the sort of myocardial necrosis that we've seen in animals with anesthetic-induced myocardial necrosis. And this is what happens to those cases as they go on. They become fibrotic. And we believe this is all the same condition. We believe that endomyocarditis proceeds to left ventricular endocardial fibrosis. It usually only involves the left ventricle. It's most severe in the outflow tract. And this is what used to be called restrictive cardiomyopathy. That term has been used for other things lately, so we don't tend to use it. This is what that looks like. In the area where we used to have granulation tissue, now we have fibrous connective tissue. These cats conveniently tend to be older than the cats with endomyocarditis, and their lung lesions tend to be less. But remember, there's a severe lung lesion in these cases in many times, and that is probably what kills these cats, not necessarily their cardiac lesion. We still don't have any clue what causes this, whether this is an immune-mediated phenomena, whether there's a virus involved. We just don't know. We're also still not sure of the relative significance of the heart and lung lesions. In many cases, we're convinced it's one versus the other. But you need to look at both the heart and lungs in these cases. Shift gears a little bit. This is a dog. Looks sort of like the cats with dilated cardiomyopathy, and this is a dog with dilated cardiomyopathy. We see these relatively common in certain large breed dogs. We have no clue as to what causes them either. This is also a dog. We don't see this condition much in the cat. This is usually occult clinically. These animals present for a wide variety of different organ system failures. They often will have myocardial infarcts as well, and this is vegetative endocarditis. Very common compared to how often it is diagnosed clinically. Now with echocardiography, this is diagnosed more commonly, but still a lot of these cases are missed. This involved the left AV valve, which is the most common site. Here's another dog with aortic valve involvement, vegetative endocarditis. Sometimes we can isolate bacteria from them. Sometimes we can't. Sometimes I think they're sterile. I don't know. Okay. Old age changes in dog hearts are relatively common. This is the dog heart. There's a number of lesions here. Got dilated left ventricle. Got thickening of the AV valves, endocardiosis. And we've got these areas of fibrosis in the atrium. These are jet lesions, all common manifestations. When things get out of hand, and we've seen a number of these cases over the years, we've put this little piece in here so you can see the ruptured chordae tendineae. And if you look up here, you can see the split in the atrium. So this is, again, another manifestation of endocardiosis in the dog, the chronic congestive heart failure causing condition that when these dogs rupture these chordae, they develop very serious and rapid onset disease. Another case with endocardiosis, and this we have a complete atrial split. Some of these split and then heal again. Others rupture into the pericardium and lead to acute cardiac tamponade and death. Some rupture through the atrial septum and lead to an atrial septal defect. Okay, here we have the heart, pulmonary arteries. I'm sorry, this is the heart here, and the pulmonary arteries, heartworms, and we have the villus endarteritis that is seen with heartworm disease in the dog. We still see these occasionally, even with all the preventative medicine out there. This is just a close-up of the endarteritis that occurs very rapidly with the presence of these heartworms in the pulmonary arteries. This is a little less common. Here's the heart, there's the liver back here, is the diaphragm, and this is the venal caval syndrome, where the heartworms are present in the vena cava and lead to severe congestion of the liver. Here's something we see occasionally in the dog. We don't know what the cause of it is, and that is idiopathic pericarditis. The pericardium is often thick. There's often effusion. Sometimes these dogs will do better for a while after the pericardium is removed. They have chronic inflammation here. We've looked for various things for a cause of this. We've never found one. If any of you have any thoughts, I'd like to know about it. This is an even more common lesion. This one is of no significance, and this is a dog, and on the surface of the epicardium of the right atrium and dorsal right ventricle, there are these little granular lesions, which are areas of chronic granulation tissue and inflammation. This is chronic epicarditis in the dog. Again, we don't know the cause, but it seems to be an incidental finding. This is also in a dog. This is the left heart, the left atrium. Sometimes these are more white and plaque-like. Other times they have little thrombi sticking on the surface. This is a classic. This is uremic endocarditis in the dog. We don't know why it occurs in this site only. It doesn't occur in other chambers of the heart. And we don't know why it doesn't occur in all cases of animals with uremia. This is a dog. We have a very globoid-looking pericardium here, and this is usually due to pericardial effusion or tamponade. And the most common cause for these acute lesions, when they occur, are very small right atrial masses that bleed. This is the big hematoma that was removed from the pericardium around the heart. Often we'll see a little manifestation of some of these sprinkled through the lungs. And this is hemangiosarcoma. Another example from a dog, right atrial hemangiosarcoma, multiple miliary hemangiosarcoma in the lungs. A lot of people make a lot of points about where the primary is in this disease. If you know where the primary is, in most cases, you're better than I. Okay, another dog, old dog with endocardiosis. Also has a big lump here, just on the other side of the atrial wall. Many of these are clinically silent, other than them seem to cause some cardiac disease, and they may spread within the chest cavity. And this is a heart-based tumor, a chemoadectoma, or in this case, an aortic body tumor. Okay, this is a cat, and this is the pericardium. I'm sorry, I take it back. This is a dog. This is a dog. And this is a rare tumor that we see occasionally, and this is a mesothelioma. This This is something we do see occasionally. We do see metastatic tumors to the heart, and they are usually carcinomas, or in this case, lymphosarcoma. Lymphosarcoma is by far the most common. And for some reason, lymphosarcoma in the heart tends to be firmer. They don't tend to be the soft, tan, bulging masses that we often see in other parts of the body. So they will fool you grossly when you see these. Okay, what is your differential diagnosis? Well, again, you've seen this picture before with this cat, firm lungs, there was some fluid in the chest, big left atrium, big heart. So you should be thinking, is this endomyocarditis? Is this left ventricular endocardial fibrosis? Is this hypertrophic cardiomyopathy? Or is this thyrotoxic cardiomegaly due to adenomas of the thyroid gland? This happens to be endomyocarditis, but you can't tell just by looking at the outside. You have to do the histology and do the rest of the post. Make sure you look at the lung lesions as well. Okay, we're on to the lymphoid system. There is more than one disease of the lymphoid system, so we'll have to cover a few things. Common lesion in old dogs, end of the spleen, siderofibrotic plaques, common dilemma in the spleen of the dog. What is this? Is it nodular hyperplasia? Is it a hematoma subsequent to nodular hyperplasia? Or is it hemangiosarcoma? Well, you can't tell by looking at the outside. The one thing we know is they're probably not hemangiomas. Those are relatively rare in the dog spleen. This is a nodule of hyperplasia in this dog. This is a nodule of hyperplasia that's developed hemorrhage and is a hematoma. But you can't tell from looking at the outside. You have to take multiple sections through the edges here to see what they are. Okay, this is a cat. We have a big spleen, slightly yellow cat. This could be big for a variety of reasons. Could be a response to inflammation, could be sucking up blood in a case of hemolysis, or it could be neoplastic, one of the round cell tumors. This happens to be hemobartonella. Usually these are complicated by feline leukemia virus as well. Stomach from a dog. This is a rather different manifestation, although not necessarily very uncommon, of lymphosarcoma in the dog with diffuse infiltration of the stomach. We also see this in the small intestine and colon as well, in which case there are superficial erosions and ulcers. Spleen of a dog. This is a rather classic picture. Sort of pink tan spleen, very enlarged. You can't tell that from this slide, but it is, with these discrete areas at the edge that are black or brown or tan. And this is lymphosarcoma with multiple infarcts. Usually we find venous thrombi in the spleen. Okay, this is from a cat. This spleen has multifocal areas of necrosis. This could be due to a variety of things. Toxoplasmosis would be high on my list, but this could be a septicemia as well. This is from a dog. What is it? Well, your differentials hopefully are nodular hyperplasia, hematoma, or hemangiosarcoma. In this case, it happens to be hemangiosarcoma. Okay, this is a spleen from a cat. Big white tan nodules, soft, bulge. This is lymphosarcoma. Could it be metastatic carcinoma? Sure. Large, bulging, pink tan spleen from a dog. Any round cell tumor, this case happens to be lymphosarcoma. Solitary mass in the spleen, very firm, central areas of necrosis. Could this be a hematoma? Sure, but not likely with this firm band of tissue around the outside. Could it be a hemangiosarcoma? Possible, but again, not as much hemorrhage and more of this tan tissue. This is a primary splenic sarcoma. We see lots of different primary splenic sarcomas. In this case, this was malignant fibrous histiocytoma. We also see leiomyosarcomas, fibrosarcomas, and other sarcomas in the spleen. Another large spleen from a dog. Could be any round cell tumor. This happens to be a myeloproliferative disease. There was also bone marrow involvement. Large spleen from a cat. Again, you can think of any different round cell tumor, but you also want to remember that we see mast cell tumors in the cat manifest as large spleens and usually livers as well. This is from a dog. This is an appearance we see commonly with this tumor in the dog. This happened to be a Great Dane, but maybe I'd help you if we made it a Bernese Mountain Dog. These white, tan to yellow, brown nodules all through the spleen and usually the liver. And this is malignant histiocytosis. But you'd have to consider a whole series of other differentials as well. This picture's a little hard to see. This is the spleen, and this is the liver. And this is what happened to these primary splenic sarcomas. When they do metastasize, they tend to end up in the liver. Okay, the bone marrow. We like to look at the bone marrow grossly as well as collect samples and do cytology if we can, if it's not been dead too long. In this case, we have this white tan tissue in here that sank, plus this bright red tissue here. Number of things you have to consider: metastatic disease, primary disease. This case was lymphosarcoma and a very reactive bone marrow. Lymph nodes, soft, tan, bulging lymph node from a dog, rather young dog, and this is lymphosarcoma. From the same young dog, it had a skin mass. Sometimes these can be seen as diffuse involvement of the skin. The skin's on the bottom here. And this is lymphosarcoma. Okay. Next to the last slide in this section is the liver. And the thing you want to notice here is the red areas are the relatively normal areas. These areas are the abnormal areas. Again, this could be fatty liver, this could be a steroid hepatopathy, but since we're on the topic that we're on, this is what lymphosarcoma or any of the round cell tumors look like when they infiltrate the liver diffusely. I'm sorry, this is the next to last slide, actually. This is just what icterus looks like in the dog. Usually it's due to immune-mediated disease, but we can also see it with liver disease. And the last slide is your responsibility is to tell us what the actual and fictional locations of this slide are. And I won't tell you the answer. Okay, that's it for that carousel. Next, we're going to talk about the liver, pancreas, and peritoneal cavity. This is a cat. Common finding in the cat of no clinical significance, the bilobed gallbladder. This is another cat, and this is of some significance. See, these are older cats. And these are areas of telangiectasis, dilation of the terminal ends of the sinusoids. This is a relatively rare condition in a dog, but one you want to be able to recognize. This is a young puppy. It had severe ascites. It also had hepatoencephalopathy. And what we have is an arteriovenous shunt in the liver of this dog. This is not a portocabal shunt. These dogs have their hepatic artery come in and anastomose, usually in one of the liver lobes, with the hepatic vein. Most of these reported have been surgically removed. These actually throb, these liver lobes, and they can tell which lobe to remove. What you see elsewhere in the cavity in these dogs is invariably, here's the AV shunt here, is multiple acquired portosystemic shunts, because the artery pumping into here gets into the portal vein circulation, and the portal vein actually runs in reverse in these dogs. The blood goes away from the liver. It's another interesting, what appears to be autosomally recessively inherited disease in the dog. This is a young West Highland White Terrier. This is something that Dr. Makalus and Dombach in our lab are working up. And this is a polycystic liver. There are cysts all through this liver, but they're very small, and there's also some large ones in the hilar area. And these animals also have another condition, similar to what is seen in other species. They also have polycystic kidneys. These animals do not do well. This animal was quite sick at 8 weeks of age. Okay, liver from a cat, rather classic. Do all of us a favor and do not call this hepatic lipidosis. This is fatty liver, and the cats that have this without other disease processes should probably best be called fatty liver syndrome, like is seen in chickens and rabbits and cows. We also see this manifestation of fatty liver with lots of other things, starvation, diabetes mellitus, and go on from there. Large liver from a dog should have a couple of differentials. The most common cause of this large sort of yellow, tan to orange liver that we see in the dog is not fatty change, is not diffuse infiltration of lymphosarcoma, but steroid hepatopathy. So this is a steroid hepatopathy, infiltration of accumulation of glycogen in the central part of the hepatic acids. Okay, this is also a dog with right-sided heart failure, and this is fibrin on the surface of the liver, and this is a chronic passive congestion liver. And you can see this sort of classic reticular pattern here that's also been referred to as a nutmeg liver, because when you cut a nutmeg in cross-section, you can see the same pattern. So you should all go down to Grenada and get some nutmegs and cut them up. Liver from a dog. This liver is swollen, waxy. This is a cross-section through the liver. We don't see this as commonly in the dog, say, as we see in waterfowl. But now with lots of Shar-Peis around, we're going to see more of this. This is amyloidosis of the liver. Shar-Peis, of course, have it in other organs as well. It's a young puppy, I think it's about 6 weeks of age. No, it's a little younger than that, maybe 4 weeks. 2 weeks, I'm sorry. And we have these multifocal red spots on the liver. We're also going to see these in the lung, although it's not as easily to see here. And you also see them in the kidney, and this is what herpes virus looks like in the puppy. We still see a fair amount of this, particularly in some colonies. Okay, this is a fixed liver from a dog. It could be a cat. And we have multifocal areas of necrosis here. Again, when it's multifocal random, you should be thinking of some sort of infectious process. We see this with toxoplasma. You could also see that with other bacterial diseases. We have seen multifocal random necrosis recently in a lot of dogs with Tizer's disease. Those were all laboratory animals that had that. This is a liver from a dog. It could be a liver from a cat with similar changes, sort of mottled looking, a little swollen, a little firmer than normal. And this is chronic cholangiohepatitis. There's nothing specific about this picture that would let you know that. That's what they look like. Okay, I want to tell you a story about a group of cats. We had a group of cats, 9 out of 10, who have received oral benzodiazepines. 5 were extremely healthy at the time that the therapy began. The others were only marginally ill. Signs of liver disease began within a week to 2 weeks of beginning therapy, and all were dead within 4 days after the signs began. This is what their livers looked like. They were small. Most of them were around 2 to 2.5% of body weight. They were very flabby. They were tan red mottled. And histologically, there was severe, often complete central lobular necrosis, which often extended all the way to the portal areas, bile duct hyperplasia. And I don't see this particular pattern of disease very common in the cat. Our conclusions were that this condition is an idiosyncratic reaction to benzodiazepine therapy in the cat. Benzodiazepines are often used for behavioral manifestations of disease. We don't know what the incidence and pathogenesis is, although we know that this drug is metabolized in the liver. We also know that the majority of cats given this drug do not develop disease. But as we see increasingly cats being treated for behavioral problems, I think we're going to see more and more manifestations of various organ disease. Okay, another iatrogenic lesion in a dog. This is a very small liver. Usually these livers are around 1.5 to 2.5% of body weight. Nodular, firm, tough to cut. And this is diffuse hepatic fibrosis, nodular regeneration, and bile duct hyperplasia, also known as cirrhosis. And we know a number of things that lead to this in the dog. This case happens to be a dog that was on long-term phenobarbital. Primidone will do the same thing for probably the same reasons. This is a Doberman's liver, very small. This one was around, I think, less than 1% of body weight. Nodular, finely nodular though in this case, so sort of micronodular, very firm, although you can see macronodular cirrhosis from the same condition apparently. Again, female Dobermans, chronic active hepatitis can lead to this. We also see this commonly in Cocker Spaniels and a variety of other dog breeds. We do not see cirrhosis as such in the cat. I have rarely seen a case of hepatic disease in the cat that led to such severe fibrosis and nodular regeneration like we do in the dog. Okay, I don't have very many good slides of this. This is a Bedlington Terrier, small, firm, nodular liver also, so we have to remember copper toxicosis as well in this disease. But we still have to remember that the majority of the dogs we see with cirrhosis have not been on long-term anti-epileptic drugs, have had no history of chronic active hepatitis. We don't find a lot of copper in their liver, so we don't know the cause of most of their disease. But we know some of the manifestations. These dogs often have ascites, they have nodular livers, and they have multiple acquired portocable shunts. If you look hard for these acquired portocable shunts, you'll find them in most dogs with chronic liver disease. You just have to look carefully for them. This is, in addition to their liver dysfunction, is probably one of the reasons why they develop severe hepatoencephalopathy. These dogs are also usually slightly icteric, although not often very icteric, and they usually have coagulopathies as well. Okay, something we've seen in a couple of cats recently, and that is chronic liver disease with these little black objects in the bile ducts, and these are flukes. The two cases we saw recently were two different flukes. I don't remember their names, but there are a number of flukes that have been described in domestic cats, and they can lead to chronic cholangiohepatitis. In one of the two cases we saw, it also had cholangiocellular carcinoma in the liver, which is similar to what we see in humans with chronic cholangiohepatitis and fibrosis. Another thing we're seeing more in cats than in dogs is chronic biliary disease with very thickened bile ducts with or without cololiths. When you look at these histologically, some of them look almost pre-neoplastic. So we wonder if maybe this is a manifestation of some sort of toxin that's affecting the bile ducts and biliary tree in these cats. Okay, common aging change in the dog, not the little coffee stain here, but these nodules here. If you look at dogs' livers carefully when they're over 9, 10, 11 years of age, you'll find these routinely, and these are areas of nodular hyperplasia. We like to refer them as nodular hyperplasia, the common age change, rather than nodular regeneration, the nodular response to injury of the liver, although histologically they look very similar. And they may be actually the same process. This is a picture I believe I got from Cornell from Dr. King. This animal has probably some fatty change in the liver and also has this nodule. And in these nodules of hyperplasia, there may be more fat in some areas, maybe more areas of sinusoidal dilation in others, so they can look quite different, and it's still the same process. We get these all the time from surgeons who think they have some sort of primary hepatic tumor, and they don't like to believe you when you tell them it's just nodular hyperplasia. Okay, this is from a dog, could easily be a cat, and this is infiltrative disease in this liver. This liver is larger than normal, You could say this could look like a toxic disease, but most of the toxic diseases with necrosis, the liver will be smaller than normal. These are round cell tumors. This happens to be lymphosarcoma. This is a boxer dog. Multiple nodules, white tan, soft, some with umbilicated centers. You'd say this is probably granulomatous disease or metastatic carcinoma. Well, this is another manifestation of lymphosarcoma. It can look like anything, just about. Another dog, swollen, large liver, greater than 3.5 to 4% of body weight. And this is myeloproliferative disease. It could also be lymphosarcoma or any of the other round cell tumors infiltrating the liver. This is another dog, this time more nodular lesions. Could this be lymphosarcoma? Sure. Could it be some other sort of tumor? Yes, it happens to be mast cell tumor in this case. So I rarely can look at the liver tumor and say what it is. We like to do impression smears at the time of autopsy, and that helps us, and of course follow it up with histopathology. This is a Great Dane. You saw its spleen before, and this is somewhat interesting the way that most of this particular tumor ends up looking sort of yellow tan like this, and this is malignant histiocytosis. This is the one you hope to get on the boards, but then you think maybe they're trying to trick you. Lung, liver, and a mental involvement, probably also spleen, probably right atrium as well, hemangiosarcoma in the dog. Liver, spleen from this dog, involvement of the heart. I think the pericardium is still intact here, I'm not sure. Lung, so hemangiosarcoma. And they often will have these plaque-like lesions in the liver that extend as shallow nodules into the parenchyma. Okay, this is also a dog. Again, could this be lymphosarcoma? Sure, but classically with these umbilicated centers like this, and these are firmer than lymphosarcoma, these are metastatic carcinomas. A lot of the abdominal carcinomas end up in the liver. This is very common. A dog, could be a cat. Cystic, soft lesions in the liver, usually solitary. We usually refer to these as biliary cystadenomas, whether they're congenital cysts or true tumors or not. Sometimes it's hard to tell. This is an old cat with a large biliary cystadenoma. This is a dog. These are usually older dogs. This is a hepatocellular adenoma or hepatoma. We've also seen nodular hyperplasia be this large, and we try to distinguish them histologically as best as we can. Often there's necrotic centers to them. This is another dog. This dog didn't have any tumors anywhere else in the body, and this is a primary cholangiocellular carcinoma, but this could easily be metastatic carcinoma as well. This is another manifestation in the dog of primary cholangiocellular carcinoma. This is a rather rare tumor in the dog, sometimes difficult to distinguish from hepatomas versus nodular hyperplasia. But when they're this big and if they invade the rest of the liver, I've rarely seen these metastasize. We call them hepatocellular carcinomas. Certainly the incidence of this lesion in the dog is much lower than that of the cholangiocellular carcinoma, although there are a few textbooks out there that say the opposite. Clearly they did not see the population of animals that we see. Gallbladder in the dog, common aging lesion, cystic mucosal hyperplasia. Okay, moving to the pancreas. Something we see commonly in the pancreas, but we don't know its significance. Maybe it's an early manifestation of pancreatic necrosis, is edema of the pancreas and the surrounding tissues. Sometimes it seems to be an incidental finding, or maybe due to other diseases that lead to edema, hypoproteinemia, things like that. Another problematic lesion that we see at postmortem in the dog and rarely in the cat, although in this case it is a cat, and that's hemorrhage involving the pancreas and the mesentery. And this seems to be almost be an incidental finding in some cases. Okay, this is a dog. This is the mesentery adjacent to the duodenum. And all you can see are the ducts of the pancreas. There are no acini here. There are islets in here, though, histologically, because these dogs are not diabetic, usually. And this is exocrine acinar atrophy or hypoplasia. I'm not sure how you can tell when it's a young dog for sure, but if the ducts are present, many people refer to this as atrophy. But it may actually be a hypoplastic lesion. These dogs usually have exocrine pancreatic insufficiency. In the older dogs, we also, just as we see in the cats, we also see chronic atrophy with some areas of nodular hyperplasia, very little normal acinar structures left in here. And again, some of these dogs do have exocrine pancreatic insufficiency. In the cat, this is an old cat. These are very common changes. And this is nodular hyperplasia as well as dilation of the ducts in the pancreas. I didn't recognize this ductal dilation until relatively recently, but now that I recognize it, I see it all the time. Of no clinical significance. This has rather dramatic clinical significance, even though the gross lesion may not be very severe. Often the histological one is. This is a cat. And peripancreatic fat necrosis. This peripancreatic fat necrosis we've even seen in the subcutis. So it's not peripancreatic anymore. There's usually edema, and there's also necrosis of the pancreatic acini. So this is acute pancreatic necrosis and peripancreatic fat necrosis in the cat, also referred to by the clinicians as pancreatitis. This is another manifestation of this in the cat. Again, lots of necrosis. Sometimes there's some icterus in these cats because I think they get some blockage of the bile duct from the swelling. Again, there's necrosis of the pancreas, often involves both limbs. We've published a couple of papers on this. The hard part is diagnosing these clinically. They've had better luck using trypsin-like immunoreactive substances rather than the amylase and lipase, which do not go up in the cat, at least very often. And the cats also don't have the tremendous hemorrhage that you see in the dogs with acute pancreatic necrosis. And here's a case from a dog with rather dramatic hemorrhage and necrosis. Sometimes these are diffuse, sometimes they're focal, sometimes they're multifocal. This is a very serious disease in the dog. We're working on a paper now on the ultrasound imaging of these and also on a retrospective looking at the possible causes, because we still have no idea what causes this disease in the dog or in humans, although there are some things that clearly are related. Duodenum, pancreas, necrosis. There's also some firm areas in this one, so many people refer to this as chronic recurrent pancreatic necrosis or pancreatitis. I tend to lately have been calling these more acute pancreatic necrosis and fibrosis. I don't know what caused this initial fibrosis. Maybe it was a previous manifestation of necrosis, maybe not. You can decide. Okay, an old cat, firm pancreas. These cats are usually not ill. They do not usually have exocrine pancreatic insufficiency. This is usually an incidental finding of chronic pancreatic fibrosis. It's usually interstitial. And there's often some non-suppurative inflammation here. This is not pancreatitis in the cat. This is not significant. This is significant. We see this in both dogs and cats. They're often very difficult to determine what the primary is when you have all these mets in the liver and tremendous involvement of the pancreas. You have to take a lot of sections through here. In many cases, we are able to determine by what they look histologically and where we find the primary that these are pancreatic carcinomas, well, either acinar or ductal, with mets to the liver. We've seen liver carcinomas, biliary, that seem to metastasize to the pancreas as well. So you have to be careful. Okay, this is a dog. We don't tend to see this in the cat. These are usually at the ends of the lobes of the pancreas. And these are islet cell tumors. They're often beta cell tumors, and they're often making insulin if they're clinically significant. And of course, you can't tell one from the other because they all look alike, whether they're benign or malignant. But when they do metastasize to the liver, they can look like this. So this is a metastatic islet cell tumor in the liver. Often these dogs tend to live a long time. This was a dog. Okay, this is a good one to trick people with. This is in the mesocolon of the cat. And these are not little parasites. These are the Pacinian corpuscles, common things that we see in the cat's mesentery and pancreas. They're normal. This is not normal. This cat's abdomen contained a lot of yellow stringy fluid, and covering the surface of a number of organs were these plaque-like lesions. So this is feline infectious peritonitis. We also occasionally see in both the dog and the cat, and this happens to be a cat, peritonitis that is probably of bacterial origin. In this case, it was due to a ruptured intestine. We see that with ruptured intestine, ruptured stomach. We can also see it as a progression from pyometra or from outside wounds. So we do see peritonitis occasionally of bacterial origin. This is a disease we don't see very often because somebody's paying attention out there, hopefully. Yellow discoloration of, and this is a cat, of the fat in the abdomen. These cats, you can smell them from across the room. They smell like rancid fish. And this is steatitis. This is not the same as peripancreatic fat necrosis. This looks and smells quite differently and has a very different pathogenesis. This is a dietary problem in these animals due to feeding of excessive certain diets of certain types of fish. This is another important lesion for people to recognize. This is could be a cat or a dog. The lesion looks very similar. In this case, this is a cat. And when you see the intestines all bunched up like this and the omentum all in a ball near the stomach, this is not string foreign body. This is carcinomatosis. This is what carcinomatosis does to the abdomen terminally. It's important to recognize because it's often hard to find the primary. Could be any abdominal carcinoma, could be mammary carcinoma, and so you have to look very carefully. In this case, there was a small biliary carcinoma embedded in this liver that was the primary. Okay, this is the omentum from a dog. And this is what it looks like before it completely contracts. These very firm nodules all through the omentum, omental carcinomatosis. We've occasionally seen lymphosarcoma also infiltrate the omentum. So it's an important differential, but usually those are softer, more tan and bulging, where these are firm with lots of desmoplasia. Okay, a rather rare tumor of the dog and even rarer of the cat. This is a dog. And this is a mesothelioma. We do see these occasionally, both in the chest and the abdomen and the pericardium. Okay, this is a heart from a dog. Atherosclerotic plaques in its vessels, and the question is, what's the other lesion in this dog? And the other lesion is something wrong with its thyroid. These animals are invariably hypothyroid, and they usually have either thyroid atrophy or lymphocytic, plasmacytic thyroiditis. Okay, a little quiz for everybody. And then we're going to go on to the endocrine system. This is the way I feel on bad days. I don't understand anything. Okay, the endocrine system. This is a young kitten. This is something I've not seen very much of. We have very large thyroids, and this is a congenital hyperplasia or goiter. This is also a cat, but it could be a dog. These are very common, these cysts that we see in the thyroid. These are Thyroglossal duct cysts, other people refer to them as branchial arch cysts. They often have ciliated epithelium lining them. They are not of thyroid origin. They're extremely common in the dog. This is extremely common in the cat these days, and maybe it always was, who knows. Thyroid nodules. These cats are hyperthyroid. They often have manifestations throughout their body, including their heart. And these are referred to by some people as adenomatous hyperplasia. Some people call them adenomatous. Some people call it toxic nodular goiter. I prefer the term adenomatous hyperplasia. It tells us what we don't know. We don't know whether they're adenomas or hyperplastic lesions. Here's another cat with two problems. It's got nodules, so it's got adenomatous hyperplasia, and it also has these big white things, the parathyroids. So it probably has either renal disease or nutritional hyperparathyroidism. Another set of thyroids from a cat, very large white nodules. These are parathyroids, and this cat had severe chronic renal disease. This is parathyroid hyperplasia. It's a little hard to get oriented in this one. This is the neck of a dog, and we have the jugular vein open and these firm white material in the jugular vein. And this is vascular invasion of a thyroid carcinoma. Okay, this is from a cat, although we see the same lesion in the dog. And this is the adrenal glands, and we have hyperplasia of the adrenal cortices, usually due to a pituitary tumor. So this is pituitary-dependent Cushing's disease. This is an adrenal gland from a dog. And what we here have is dramatic cortical atrophy. And there's lots of different things that can cause that. Certainly the most common is probably the idiopathic Addisonian case, where there is either severe atrophy or atrophy with inflammation. We also see this with lysodrin therapy. We also see this with destructive pituitary tumors. And we can also see this with long-term corticosteroid therapy, stopping ACTH production. So lots of different possible causes for this. This is a tumor in the adrenal gland of a dog after it's been put in dichromate solution. The cortex, there's the medulla, and here's this brown mass. So this is a pheochromocytoma. This is a mass in the adrenal gland of a dog, and it's white tan, and the cortices are very thin. So in this case, this is a functional steroid-producing, glucocorticoid-producing adenoma of the cortex of this adrenal gland. We see lots of these where there's no atrophy of the cortex, so they're non-functional. Okay, this is a little hard to get oriented, but this is the liver, and this is the caudal vena cava, and there's a big mass sticking into the caudal vena cava. The kidneys would be back here. And this is an adrenal gland tumor. It could either be a carcinoma or a pheochromocytoma. Both will invade the caudal vena cava. This happens to be a carcinoma. The next case, here are the kidneys here, and there's the mass invading the caudal vena cava. This happens to be a pheochromocytoma. So they both can do this. These are both in dogs. Another thing we see common in the adrenal glands is metastatic carcinomas. This happens to be a dog, and that's probably where we see most of them. And a variety of different carcinomas can end up in the adrenal gland. Okay, the next to the last slide is pancreas of a dog. And you should recognize this as an islet cell tumor, like the previous one we saw. And the last slide from a cat. We have a pituitary tumor, and remember in the cats these can be functional and make growth hormone, which will also cause adrenal gland hyperplasia as well as hypertrophy and hyperplasia of other organ systems throughout the body. Okay, and that's it for the endocrine system. Okay, next we're going to talk about the oral and gastrointestinal tract. This is a common change that we see in young puppies, and that's a cleft palate. This is relatively uncommon. This is from a dog. Little hairs on the tongue, glossotrichia. This we don't see as much as we used to from the dog. It's a young dog. Has enamel hypoplasia. The most common cause of that is usually canine distemper virus infection. This is a common thing that we see. Often these areas are more red. And this is from a dog. We see these in the cat as well, although the cat can involve the other parts of the oral cavity as well. And this is uremic ulcers. Again, many of these diseases in the dogs and cats where there's oral ulceration, it's very difficult to tell what they are just by looking at them. This is a case in a dog with toxic epidermal necrolysis or necrosis that also involved the oral cavity. This is a case with multifocal ulcers in the dog's oral cavity that after biopsy was determined to be pemphigus vulgaris. We see some inflammatory disease in the oral cavity associated with calculi. We also see some inflammatory disease in the cat oral cavity not associated with calculi. This happens to be gingivitis and dental calculi. Sometimes associated with loss of teeth, but others not. We see oronasal fistulas in the dog. In small breed dogs that are fed a lot of soft diets, we'll often see loss of the canines and fistulae extending right up where the canine teeth were. Relatively uncommon disease in sled dogs is eosinophilic granuloma. It looks similar to what we see in the cat. And this is what it can manifest like in the cat, where we see these ulcerated areas on the oral cavity, on the lips, and you can also see it in the oral cavity. Young dogs, tumors in the oral cavity on the lips. This is viral-induced papillomas, oral papillomatosis. See this in cattle as well. Common change in old dogs are gingival hyperplasia, often associated with some prior dental disease with calculus and erosion. Here's another dog with two different problems. It's got gingival hyperplasia, and it's got this firm mass here, which is could be easily removed, and that is a fibromatous epilus. Here's a lower jaw of a dog with this mass that's infiltrated around this tooth and into the bone. A variety of things you have to consider. Could be a lot of different primary tumors, but this is also common for acanthomatous epili, and that's what this is. Oral cavity of a dog, always malignant, often extend far from the margins of the lesion. This is a malignant melanoma. These invariably metastasize. Thing you also want to remember in these dogs is that the melanomas are not always pigmented. So we see a fair number of amelanotic melanomas in the oral cavity of dogs, and they act badly. Here's metastasis of a melanoma in a dog to the heart and lungs. Fibrosarcomas in the dog oral cavity are also common. They don't metastasize as readily, but they do invade extensively. We also see them in the pharynx in the dog, fibrosarcomas. And we also see them in the cat, where they look like a small primary lesion, but they extend all the way back along the dental arcade. So fibrosarcomas in the cat. They're the second most common tumor in the cat. The most common tumor of the cat oral cavity is a squamous cell carcinoma. They're usually ulcerated. They're often under the tongue. We also see them in the jaw of the cats, where they can be surgically removed. They usually start in the gingiva. And we also see lymphosarcoma involving the tonsils of the dog bilaterally. And we see unilateral tonsillar masses in the dog that are squamous cell carcinomas. It's important to distinguish these two. Usually in lymphosarcoma, there's multisystemic involvement, where with squamous cell carcinoma, it usually starts there. Next, we'll move out of the oral cavity to the tissues around the oral cavity. And this is a dog with a salivary mucocele that we've cut open. These are very common. And this is a rare condition in the dog where we have a salivary duct with calculi in it. These are more common in other species than the dog. Okay, larynx from a dog, solitary mass. It's a rhabdomyoma, previously called oncocytomas. These tend to be benign, but they're sort of difficult to surgically remove. From a dog, a couple lesions here. It's a Sheltie, young dog. Dermal lesions, megaesophagus, inhalation pneumonia, very firm, some barium in here as well as other things. And this is dermatomyositis, one of the many diseases that manifest themselves as esophageal disorders. Okay, this is the esophagus from an old dog, common postmortem change. Dilated esophageal gland ducts, no significance. Esophagus from a dog. Cats don't tend to do stupid things like this as often. This is a esophageal foreign body that's led to secondary erosions of the distal esophagus near the gastric junction. Esophagus from a dog. And see this greenish discoloration from bile, and this is what you can see with reflux esophagitis from chronic vomiting. This is also from a dog, and again, we have these multiple erosions and ulcers in the esophageal mucosa. This is a more common manifestation of reflux esophagitis, and these can be overlooked if you don't look carefully at the esophagus. And this can be the result of esophageal injury, again, in the dog. And these are esophageal strictures. And these are very difficult to manage, either medically or surgically. Okay, distal esophagus of a dog, focal mass. This was in the wall of the esophagus, and this is a leiomyoma. Distal wall of the esophagus of a dog. This mass has got little worms in it. So this is a granuloma due to Spirocerca lupi. We don't see much of these in the Northeast, but I understand they're still prevalent in some warmer parts of the world. These can lead to sarcomas, which can metastasize to the lungs. Large breed dog, very dilated stomach, and this is the sort of necrosis we see with gastric dilatation and volvulus. Gastric dilation and volvulus. And this is what it looks like on the inside. This area of the mucosa is necrotic, usually clear back to somewhere in here. On this side, you can see the demarcation relatively well. No one knows the cause of this condition, as far as I know. This is something that has been reported in a few breeds of dogs. This is a Basenji, and this is giant hypertrophic gastritis. But we have actually seen a number of lesions like this in a variety of breeds of dogs where they have a few rugae that are very hypertrophied and hyperplastic and maybe have a little inflammation in them. Mostly an incidental finding. Okay, this is from a dog. We have a stomach with all these little white lines in it and these areas of hemorrhage. And this is the classic appearance of uremic gastritis from the serosal surface, usually with mineralization. That's what all this white stuff is. And this is what it looks like inside. These animals often have areas of edema, hyperemia, erosions and hemorrhages, and if you sniff these stomachs, you can smell a distinct odor of ammonia in most cases. stomach from a dog. Large perforating ulcer. Variety of different causes of gastric ulcers in the dog, including carcinomas, among other things. This is also a stomach from a dog. And this is another gastric ulcer. Again, these are associated with a variety of medical conditions as well as tumors that involve the stomach. This is not what you see with uremia, though. We do not see these large crater-form ulcers with uremic gastritis. Somehow that has entered people's minds, but it is not what we see. Occasionally we do see gastric ulcers from foreign bodies. This is a dog that continually ate coins and seemed to be associated with the erosions and ulcers that we saw in the stomach. As we said before, you can also see gastric ulcers with a very thickened gastric wall, usually not distinct masses, and this is a classic presentation for gastric carcinomas in the dog. This is also from a pylorus of a dog's stomach. We see these as incidental findings, these little gastric polyps or adenomas or adenomatous polyps in the pylorus of the dog. Well, you can see them in other sites as well. Stomach and pylorus and proximal duodenum of a dog, large crater-form ulcer. You see these with a variety of conditions. Here's another one, same sort of area, large ulcer, a little more acute. This one was associated with a mast cell tumor. We see them associated with certain drugs, liver disease. This is a very rare condition in the intestine of a dog, a little diverticulum that's reminiscent of Meckel's diverticulum. This is a disease that I've not seen for 10 or 15 years. This is small intestine from a dog. This is brown dog gut or leiomyometaplasia associated with vitamin E problems, usually deficiency. Classic lesion from a cat, although in this case we can also see it in the dog. In this case it's a dog, but we see this more often in the cat. This is a linear foreign body. Rather common finding in dogs, and this is the common thing we find in them. And there's dilation in front of them. There's an obstruction here with ulceration. This is a corn cob. We also see them with rocks. From a dog, this is an intussusception. From a dog, another intussusception with the outer part open. And this is something we've seen associated with surgical sponges left in the abdomen. They seem to make this granulation tissue around them, and maybe they change how the gut next to them moves or how it is anchored, and we see intussusceptions result as well. So, slide for your surgeon friends. This is a tricky one. No hemorrhage, no edema, and this is a post-mortem intussusception. This is not a significant finding. You can pull these right apart. They're very easy. There's no evidence of tissue change in these, and this is an important thing not to overdiagnose. Okay, this is a busy slide, but as you can see, there's where the diaphragm is supposed to be, and there's the stomach in front of the diaphragm where we don't want it to be. So this is a diaphragmatic hernia in a dog. Okay, this is a small intestine of the dog. These dogs die very suddenly. Usually everything from the middle of the colon or the descending colon up to the end of the duodenum is involved. Here's the end of the duodenum where it began. Just the end of that limb of the duodenum where it began. And this is a torsion of the mesenteric root. I know torsion is supposed to mean twisting on the long axis, but this is where most people refer to this as torsion, even though technically torsion really doesn't occur much in the dog, as opposed to volvulus, which means to roll or fold over. Okay, this is a cat, And we have an infarcted piece of gut here, and you can't see it very well, but there's a little embolus in here. So we have thromboembolic disease in the cat. What do you think the cause is? Sure, one of the cardiomyopathies of the cat. This is one you've seen before. Portal vein thrombosis, mesenteric thrombosis with infarction of the jejunum. So when you see an infarcted jejunum, don't rush to the idea that it's a torsion. Torsion usually involves a larger segment of the small intestine than just the jejunum. So whenever we see areas of the gut looked infarcted, whether they're twisted or not, we always try to explore both the veins and the arteries leading to the area so we can see what happened. Okay, a dog, a puppy, these days probably a Rottweiler, although this one was not. And we have segmental dilation, and this is the necrotizing enteropathy of parvovirus. Again, dog punched out Peyer's patches, areas of complete loss of the mucosa. This is usually segmented, multifocal. A single sample will often give you either normal or severely diseased, you can't often tell, gut. And this is not an itis in the classical sense, since these animals have such dramatic destruction of their immune system and lymphoid system at least, that they don't have an inflammatory infiltrate in this lesion until very late in the disease. Okay, this is from a dog, although it could easily be from, oh, I'm sorry, this is from a cat, although it could easily be from a dog. This is the thickening of the small intestine we see with eosinophilic enteritis. We also can see this with lymphosarcoma. This is another section of gut from a dog. This is closed, this part is opened, and this is the mesentery, and you can see these little nodules in the mesentery, and these are the little granulomatous lymphadenitis foci that we see often associated with this lesion, which you can see better on the next slide. And that is an open piece of dog gut at a higher magnification. This is lymphangiectasia. Okay, this is a piece of small intestine from a cat with a rather distinct focal lesion. It's firm. It may or may not involve more than a few centimeters of gut. This is what it looks like in cross-section. These sections of small intestine. And you can see the little nodules in here, and this is something that's been worked up by Dr. Kathy Harvey in our group at Penn, and this is focal pyogranulomatous or granulomatous enteritis due to feline infectious peritonitis virus. When you actually autopsy these animals, often these are surgical biopsies, you will find other organ involvement usually, but they manifest as a focal gut lesion, which can confuse them with carcinomas and lymphosarcomas. Okay. Thickening of the GI tract with enlarged lymph nodes that are soft and bulging. And in this dog, this is lymphosarcoma. Similar lesion in a cat with enlarged lymph nodes, and often there are nodular lesions or diffuse lesions in the small intestine. And this is lymphosarcoma also. This is a cat with one of these lesions in the small intestine that is ruptured, so we do see intestinal rupture from lymphosarcoma. Second most common tumor we see in the cat is focal carcinoma with metastasis to the regional lymph nodes. Grossly, this can look very much like lymphosarcoma. These are usually a little firmer, and impression smears help a lot with these. We've seen some dogs with this lesion where instead of having the typical carcinomas, they have carcinomas that seem to spread within the mucosa. So this runs up and down the bowel. Young dog, usually small intestine. See these tiny thread-like worms in here. So this is ankylostomiasis, or hookworms. Cecum and colon from a dog, slightly longer worms. We still see this killing dogs occasionally. And this is trichuriasis, or whipworms, with a typhlocolitis. This is a boxer dog with the regionally extensive colitis that we see in boxer dogs, still of unknown cause. Also involves the rectum in some cases. This is something you've seen before. Again, the intestines are all bunched up, and there is a contraction of the omentum. You should remember this is carcinomatosis. Could be from any abdominal carcinoma with secondary desmoplasia. Okay, this is colon of a dog. And this is the typical napkin ring lesion that we see with colonic carcinomas. Focal area, very firm, lots of desmoplasia in here. And these will spread widely throughout the abdomen, and it will be a very small focal primary, and you may miss it if you're not careful. Okay, this is the back end of a dog. There's the anus, and there is this mass here. Often there is no mass adjacent to here. You often have to, it's often a centimeter or so inside, but this can be a manifestation of anal sac gland carcinomas. You'd also have to consider rectal fistulas, but they don't usually bulge quite like this. This is the anal sac of the dog with its adjacent mass, and this is an anal sac gland carcinoma. And the last slide in this carousel is this. This could be from a dog or a cat. In this case, it is a dog. And this, you should have a variety of different differentials. This could be eosinophilic enteritis. This could be granulomatous enteritis. Or this could be lymphosarcoma. In this case, this was eosinophilic enteritis in this dog. Okay, next is the urinary system. Okay, the urinary system. This is one we've talked about before, a young puppy. Red areas of necrosis and hemorrhage throughout the kidneys, and this is a classical example of herpes virus nephritis. This is a cat, and it's what's not here is what's important. There's unilateral aplasia of a kidney. This is something we see often as an incidental finding in both dogs and cats. Okay, this is a young golden retriever, about a year or two of age. We recently published something on this with Roy Curlin as the senior author. And we see band-like areas of fibrosis in these kidneys. They're shrunken, they're firm. And this is a form of renal dysplasia or juvenile renal disease that we see in young golden retrievers. This is a cat. I'm sorry, this is a dog. And this is a animal with unilateral renal hypoplasia and an ectopic ureter on this side. This is a Shih Tzu dog, young one. And this is another manifestation of renal dysplasia in the dog. This is an elk hound, young elk hound. And this is what their kidneys often look like with their juvenile renal disease or renal dysplasia. This is a middle-aged Newfoundland. It's got one normal kidney. It's got one severely hydronephrotic kidney with hydroureter and a misplaced ureter. You can see on this slide where that ureter enters into the urethra, right next to the prostate. So ectopic ureter as well as hydronephrosis and hydroureter. This is a Persian cat. It's got a polycystic kidney, sort of similar to the polycystic kidneys and liver we showed you from the West Highland White Terriers earlier. This is a dog, common finding of no significance, small renal tubular cysts, or sometimes quite large. You'll often see them only on cross-section of the kidney, loculated, sometimes multiloculated cysts. This is from a dog, also an incidental finding, these small white dots that are also present through the cortex, and these are small granulomas due to migration of nematode parasites in the dog. This is a dog, and this dog had hemolytic anemia, and this is a hemoglobinuric nephrosis. This is another dog with a similar condition, cholemic nephrosis, and you sometimes can't tell them apart grossly. This is something that you're supposed to see, but we don't see all the time in this disease. This is a Lhasa apsa, young male, renal failure. And he's got perirenal edema, which is something you're supposed to see with ethylene glycol poisoning, but we don't always see that. It may be because the animals have been treated for a little while, and so we get them a little later in their disease now than we used to. Okay, this is a dog. Again, hydroureter and hydronephrosis. We've seen some dogs recently with ureteral stones that may lead to this, as well as misplacement of the ureters or malfunction of the ureters. Okay, this is a dog's kidney, and these are multifocal infarcts. Could they be acute pyelonephritis? Sure. This is a cat kidney. These are rather classic lesions. These areas of loss of cortex at the poles of the kidney that are referred to as polar infarcts, but I think some of these are actually manifestations of pyelonephritis, chronic pyelonephritis. So, is it acute infarcts, acute pyelonephritis? Well, in this case, these are acute septic infarcts in the kidney of this cat. This dog has prostatic disease, hydronephrosis, and acute pyelonephritis. And again, I don't think you can tell these grossly from infarcts. Here's another case of acute pyelonephritis in the dog. Maybe the distribution is a little different from typical infarcts. This is a cat with acute papillary and tubular necrosis and hemorrhage. This is another cat with a suppurative pyelitis involving the pelvic area of this kidney. This is a rather rare condition in the cat. We have a focal renal abscess. This is a dog. And again, are these chronic healed infarcts or chronic pyelonephritis? Well, in this case, at least histologically, we thought it probably represented chronic pyelonephritis. But this can be a judgment call in these cases. Common disease in the dog, little cysts, old dog, small kidney, very firm, chronic tubulointerstitial nephritis, extremely common in the dog. Another dog with another manifestation of the same problem, fibrosis, not as many cysts in this one. These are very firm, small kidneys, and these animals are usually in renal failure. Pathogenesis, you tell me. Okay, this is from a cat. This is a classic lesion in the cat. We see these white tan streaks along what probably the blood vessels and these nodular lesions on the surface. And this is the manifestation of FIP, or feline infectious peritonitis, that we commonly see in the kidney. Normal cat on this side, dog on this side. Dog kidneys yellow, tan, firm, sort of waxy feeling, and this is amyloidosis in the dog. Put a little Lugol's iodine on it, and you can see the glomeruli come out very nicely as brown dots. But that's not the only thing that causes slightly swollen, sort of yellow-tan kidneys. This is just a case of sort of subacute glomerulonephritis in the dog. And in the dog, this is the disease we've been seeing a lot lately, and Dr. Donna Dombach and our group, with some collaboration of people at Cornell, are working on this condition. Very yellow, tan adrenal cortex. Usually the kidney seems slightly larger than normal, although sometimes they look slightly smaller. Histologically, we see a glomerulonephritis as well as tubular regeneration and atrophy and a mild interstitial inflammation. And this is the glomerulonephritis and tubular necrosis and regeneration associated with Borrelia burgdorferi in the dog, or Lyme nephritis. Some of these dogs also have necrotizing or sort of fibrinoid arteritis in multiple organs, and we've been able to establish with the help of a couple of clinicians that many of these dogs are severely hypertensive. We don't think that's the cause of the lesion, and she has submitted a paper Dr. Dombach has just recently on this condition in the dog. And there's been 2 or 3 other case reports out about this as well over the years. Okay. Renal lumps in the dog. This is the so-called renal fibroma. I'm not sure if these are really a neoplastic condition. This one I am sure. Dog, primary lesion right here in the kidney, renal carcinoma. It's another dog. Here's the remaining kidney. And this is a carcinoma that broke through the capsule and also invaded through the vena cava. Another dog, mass in the pelvis. Don't forget the transitional epithelium comes up there, and that's a transitional cell carcinoma. Classic lesion in the cat, although we occasionally see it in the dog. Nodules, very soft, bulging nodules in the cortex, usually of the kidneys, and this is lymphosarcoma. Extremely common. Relatively rare in the dog is the same condition, lymphosarcoma of the kidney. Okay, this is from a dog. We have cystitis, calculi in the ureters, hydroureter, hydronephrosis, pyelitis, pyelonephritis, some atrophy of this kidney. So just about everything you can think of present in this kidney and urinary tract. From a Dalmatian dog, we got some pyelonephritis, and we've got these urate stones, urate calculi in the pelvis. Another dog, small stones, one blocking the ureter here, tremendous necrotizing cystitis due to obstruction. We also see these in cats. We got a urethral calculi, hydronephrosis, and then a perirenal subcapsular hematoma. Sometimes we also see inflammation in here. Okay, this is from a cat, urinary bladder. This is a torsion of the urinary bladder. You don't see that very commonly. This is a dog, urinary bladder. This could be edema, but this is a follicular cystitis, and a chronic cystitis with lymphoid follicles in it. The next 2 are from the same dog, hydronephrosis, slight hydroureter, plaque-like lesion here in the neck of the bladder. This female dog, close-up of that. these plaque-like lesions. This is the most common manifestation of the transitional cell carcinoma in the dog. They're most common in female dogs. Okay, the skeletal system. It's not a system I know a whole lot about, so we're going to go through it rather rapidly. Lumps in bones, you always have to wonder that there are fracture calluses, like this one is. And when you're looking at biopsies of bones, the real problem is not what tumor it is, but is it tumor or response to injury of some other sort. So look at some fracture calluses so you'll know what these sort of manifestations are. It may help you a lot when you're doing biopsies. Okay, this is a Great Dane, young Great Dane with a bowed ulna and radius secondary to retained cartilaginous cores. And this is just what those cartilaginous cores look like. This is a developmental anomaly. Another developmental anomaly in the cat. It's a normal kitty, and this is the frontal bossing of the head, deformation of the head, which also we see in the spinal cord in cats with mucopolysaccharidosis or gangliosidosis. This is also a cat. This is a benign condition in the cat. This is the normal. This is the cat here that when you shine a ultraviolet light on this bone, it's pink. And this is porphyria in the cat. It doesn't cause any clinical manifestations in the cat usually. Degenerative joint disease in the cat, we see that in a number of conditions, but in this one we see very severe degenerative joint disease involved in the femur, and this is one of the mucopolysaccaridosis. Actually, I'm sorry, this happens to be a dog with MPS 7, but it's a similar change. This is a dog with a deformed vertebral column due to a hemivertebrae. These are usually cause compression of the cord and cause clinical signs. This is a dog that can look around the corner, and these are usually young dogs with severe uremia, and this is the fibrous osteodystrophy that we see associated with renal failure. Their bones are often very soft. When we see older dogs with chronic renal failure, we do not see this dramatic manifestation. Okay, this is a dog, distal extremities with these proliferations. We often see these associated with masses in their chest or urinary bladder, and this is hypertrophic pulmonary osteopathy or hypertrophic osteopathy. This is what it looks like before you remove all the tissue. You have this proliferation of tissue, bony tissue around the periosteum or in the periosteum. This is the disease with a similar sounding name that we see in young puppies that have limb deformities, and this is hypertrophic osteodystrophy. There's necrosis, there's different malformations of the skeleton, and I don't understand this disease at all. And we occasionally see some very strange things. This is a dog that developed periosteal bone proliferation secondary to atherosclerosis and hypothyroidism. So again, maybe it was a problem with a vascular supply to the limbs similar to what we see with pulmonary osteopathy. The rare case of the dog with actual arthritis. This is osteoarthritis in the dog due to bacteria. We don't see that very often in the dog and the cat. We see lots of degenerative joint disease of the dog and cat. And this is a shoulder joint with degenerative changes, flattening of the cartilage, loss of cartilage, proliferation around the rim of the attachment to the joint capsule. Young West Highland White Terrier, cross-section through the cranial vault, large bony mass down here. This is just one of the manifestations of the craniomandibular osteopathy of Westies and other breeds. This is a proximal femur from a dog, and we've got again severe degenerative joint disease, loss of cartilage, and these osteophytes or joint mice that were present in the joint capsule. This is one that we don't see very often, but we see these in bull mastiffs. It's a proliferative osteopathy of the skull of the bull mastiff. This one we do see occasionally. This dog has had a hemisection of his head with the brain inside, so you can see this multilobular osteoma and chondroma of the canine skull and how it compresses the brain. Osteosarcomas can also develop within these benign tumors. From a dog, we have a tumor here that crosses the joint, and this is a synovial cell sarcoma, even though some people say they're not supposed to do that. This one didn't read the book. Masses in bones, sure, it could be an osteosarcoma, but this is a malignant fibrous histiocytoma that was also present in multiple other sites. Bloody masses in bones, this could be a telangiectatic osteosarcoma, but it's a hemangiosarcoma. Masses in vertebrae that cause lysis, this is a myeloma, but we've also seen various other round cell tumors do the same thing. So a rib from a dog with a large mass that was inside the chest, and this is a chondrosarcoma. This is also from a dog, and again, this could easily be an osteosarcoma or some other tumor, but it happens to be a chondrosarcoma. Things you don't see every day, but we do see it occasionally, is we see this, again, periosteal proliferation as well as metastatic carcinomas occasionally end up in the marrow cavity. Not commonly, but probably it's because we don't commonly look for them there. Okay, this is a vertebrae of a dog. We also see these commonly in cats, and this is an osteosarcoma, and these usually impinge upon the spinal cord. This is another dog. This is a femur, and this has an osteosarcoma with periosteal proliferation. This is another dog, and this is just another manifestation of osteosarcoma in the dog. These usually met to the chest. Although lately, since people have been treating them with various drugs, including cisplatin, we're seeing metastasized not to the chest, but to other bones with osteosarcoma. And these dogs tend to live longer, so you have to remember to look for that. And the last slide is for you to figure out. This is a dog, kidney, severe uremia, polyuria, polydipsia, low specific gravity to the urine. Animals are edematous, and they may be hypertensive. And this is the nephritis we see associated with Borrelia burgdorferi in the dog. Okay. Okay, we're on to the respiratory system. Start with the upper respiratory system. This is a dog. We occasionally see an acute rhinitis with canine distemper virus. More commonly, when we see dogs with severe rhinitis that's very destructive, we're usually dealing with either a fungal infection, which is this case, or neoplastic disease, such as this squamous cell carcinoma in this dog's nasal cavity. We also see other carcinomas, and this is a cat with an adenocarcinoma of the nasal cavity. And we also see cats with lymphosarcoma of the nasal cavity. So a variety of different things. We've also seen a few animals with what appear to be olfactory neuroblastomas in this area. Okay, moving down the respiratory system. This is a Siberian husky. We also see this in the Bouvier with the unilateral atrophy of the cricoarytenoideus dorsalis muscle, usually due to some problem with the vagal nerve. And this is what leads to laryngeal paralysis. Common postmortem lesion in the dog that we see is a sort of chondrodystrophy of the epiglottis in the dog. It's of no significance as far as I know, but you will see it sporadically, sort of gnarled looking epiglottis. One you've seen before, I think. Mass in the larynx of the dog, rhabdomyoma, or also called oncocytoma. Common in small breed dogs. We see widening of the dorsal tracheal ligament leading to tracheal collapse or collapsing trachea. We also see occasionally in the caudal end of the trachea or in the whole trachea in bulldogs, hypoplastic tracheas. Tracheal foam, a common manifestation of either death with no significant changes in the lung or pulmonary edema. Okay, this is a cat. This is an extremely common problem in the cat, usually due to a ruptured lung abscess, and this is a pyothorax. You can also see it with penetrating wounds. Sometimes they're not quite so wet. They're more granular and will often grow microaerophilic bacteria like actinobacillus or nocardia, actinomyces out of here. But again, what you want to look for carefully is the ruptured lung abscess, or in this case, a nice piece of plant material sticking right out through the end of a bronchus in this cat. So if you're patient, you'll actually find a cause for these in many cases. Young dogs, sudden death, hemothorax, and large area of hemorrhage in their thymus. This seems to be associated with some sort of neck trauma, but we really don't know. Multiple white, tan, firm plaques on the surface of the pleura, very common problem, both with pulmonary carcinomas, mammary carcinomas, abdominal carcinomas. This is another manifestation of carcinomatosis. That's to be distinguished from these parallel stacks of white tan material between the ribs, and this is uremic mineralization of the pleura due to chronic renal disease or acute renal disease. Okay, a cat with clear, stringy fluid in its chest cavity and plaques on the surface of the pleural tissue. This is feline infectious peritonitis, or I guess it should be called feline infectious pleuritis in this case. Dog's lung with brownish discoloration. Whenever you see this, remember that this is probably hemosiderin, and you want to look for evidence of left-sided congestive heart failure. This is what chronic passive congestion looks like in the lungs. They're usually edematous as well, although if they're treated extensively with diuretics, they might not be edematous by the time you get them. If these are nodular brown tan things throughout the lung, remember you have to be concerned about granulomas from heartworm disease. Relatively rare condition, multifocal emphysema and pulmonary bulla that can rupture. White, tan, often almost bright white material in the lungs, granulomatous inflammation associated with it, and this is due to aspiration of barium. There's the front of the animal to the right, one lung lobe, red, tan, firm, and this is a torsion of the lung lobe in the dog. We've seen them in the cat as well, I believe. Okay, this is a cat. We see these on the dorsal diaphragmatic surface of the lungs, these little white tan foci in the cat and the rat and the ferret. And these are little macrophage foci in the alveoli. They're of no significance unless you don't know what they are. This is a dog. We don't see this very often, but we do occasionally see what appears to be congenital or at least emphysema in early life or of juvenile animals in the dog. These lungs are firm and crunchy. It's got a big thrombus in the pulmonary artery, and this is uremic pneumonitis or uremic mineralization of the lung with the pulmonary artery thrombosis. Sometimes we get twofers. Okay, this is a lesion that you're going to have a hard time with grossly, but we now know about its manifestations both clinically and histologically. These are firm, heavy lungs that are diffusely involved. There's a variety of conditions that lead to this. It's well established in humans and in horses to a certain extent, in the dog less so. And histologically, you're going to see hyaline membranes, neutrophils, macrophages, congestion, beginning type 2 cell proliferation may be in here. And later in the disease, we'll see fibrosis and type 2 cell proliferation. And this is severe, diffuse interstitial pneumonia consistent with the adult or acute respiratory distress syndrome. This is the later manifestation of non-cardiogenic pulmonary edema for the animals that don't recover. Rarely do our animals develop fibrosis because they don't live long enough. And there should be a paper coming out in JAVMA soon by Dr. Parent discussing this condition in the dog. Rib impressions from dogs that have abdominal disease and push up on their lungs. There's also some edema here. This is a non-specific finding. This is something we've seen a fair amount of lately. Multifocal necrosis and diffusely firm lungs in a young kitten or cat. And this is toxoplasmosis. And it often is quite diffuse. Multifocal areas in a dog's lung that are firm, reddish brown. These are areas of interstitial pneumonia. If this is a young dog, you've got to remember that canine distemper is out there. In fact, is out there a lot these days. And you have to distinguish it from things like bacterial pneumonia or inhalation pneumonia. Cat, a rather classic lesion. There was one published that looked just about like this in JAVMA. These cats have chronic respiratory disease, and this is chronic bronchitis and bronchiolitis. And this is what cats with feline asthma look like if they live long enough or are sick long enough and eventually die. Okay, this is just a suppurative bronchitis in the dog. It happened to be Klebsiella. We see this with inhalation. We don't see a lot of primary bacterial pneumonias in the dog. Most of the animals where the clinicians think they have primary bacterial pneumonia turn out to have pulmonary artery thrombi. Okay, this is multifocal bronchopneumonia and bronchiectasis in this cat. We don't know what caused it, but we do occasionally see bronchopneumonia and bronchiectasis in the cat that is not asthma related. Okay, this is a cat. There's the lungs back here in the back, and there's this large white tan mass in the front. I'm sorry, this is a dog. Could easily be a cat with this. And this is lymphosarcoma. It's a young animal. I guess we'd have to consider a thymic tumor if it was an older animal. This is another dog with anterior mediastinal lymphosarcoma. I guess I picked these because it's so common in the cat that I showed you some from a dog too. Sometimes these dogs with anterior mediastinal lymphosarcoma will also have hypercalcemia, similar to the anal sac carcinoma dogs. Okay, multiple firm tan to brown nodules all through the lungs. This is a metastatic carcinoma. It could be a metastatic sarcoma as well. It could be a primary lung carcinoma. More lungs from a dog. And this is metastatic biliary carcinoma. More lungs from a dog. White, tan, firm nodules, almost hard. And this is a metastatic osteosarcoma. So you can't tell what they are just by looking at them. This should give you some suspicion, though. This primary soft, white, tan mass in the lung with maybe small nodules elsewhere in the body. I say primary, but I'm not quite sure about that. And this is a typical manifestation for malignant histiocytosis with a large pulmonary mass. This is a cat lung and no other masses in the body. And this is a primary pulmonary carcinoma in the cat. They're relatively common, not certainly as common as they are in humans. And this is a dog with a relatively large primary and multiple miliary metastasis of a pulmonary carcinoma in the dog. This one fooled us all. large mass in this cat's lung. We figured it was a carcinoma. It's a cryptococcal granuloma. Masses in the dog's lung. This is what we see with the metastatic sarcomas from Spirocerca lupi, but there's no reason why you'd know that without having the history. Okay, we're going to briefly talk about a few things about the eye and the ear, mostly the eye. This cat, we can see these strings running across the center of the pupil, and that is persistent pupillary membrane in the cat. And this is what happens when the persistent pupillary membranes touch the cornea. You get corneal opacities. Abnormally shaped lens in a dog. This is lenticonus. We see lots of different manifestations of lens disease. Some skin on the surface of this eye. That's a dermoid. It's a choristoma of skin. Back of a dog's eye near the optic nerve, this depressed area. This is a coloboma, a depression, a defect in the sclera. I'm not sure what causes this, but we see this in older animals sometimes. This is atrophy of the iris. This is a cat. And here's a cat with anterior synechium, so it's sort of a little volcano or mountain attached to the cornea of the iris. It's a common thing we see either congenital or genetically in dogs. This white discoloration of the cornea, and that's a lipid corneal dystrophy. Looking at the retina of this cat, you have this patch that's hyporeflective, and that's typical of the taurine deficiency retinopathy. We don't see that as often as we used to. Blue eye in the dog. Infectious canine hepatitis, canine adenovirus, or the vaccine. Either will do it. We don't see it very often anymore. Flocculent material in the anterior chamber of a cat's eye. One of the things you want to consider is feline infectious peritonitis. When you cut these eyes, there's so much protein that coagulates in these eyes when you fix them with formalin that you get this sort of white tan coagulum in the chambers and in the vitreous. We see other causes of uveitis in the cat, certainly, but this is one of the more severe ones. There's a corneal ulcer in the dog with a desmase membrane sticking through, so it's a desmetocele. This is a pretty slide. I got many of these from Dick de Bielzig or Gus Aguirre, and this is a corneal sequestrum in a cat. I still don't know what's going on in these. And this is another animal's eye with an opaque lens. So we've got a cataract here. Dog's eye with a retinal separation or detachment. Could be due to trauma, inflammation, variety of things.